Pincer impingement, on the other hand, is labrum being crushed between the neck and the acetabulum. It does not have to be from the acetabular abnormality. It can be femoral head induced pincer also. Pincer is crushing of the labrum between the head and the acetabulum. The labrum here is damaged first. In CAM, the labrum is not damaged in the beginning. You just have a chondrolabral separation here. The labrum is crushed in the beginning. And this is the only case I have that shows counter-coup damage on the back of the acetabulum from anterior FAI. It's a patient, a skiffy patient with a lot of damage in the posterior aspect of the acetabulum. It's counter-coup damage. These are things you can see intraoperatively from damage, usually from a pincer on the head-neck junction. This is an example of a skiffy. Instead of CAM, it causes pincer damage. You can see how it's pinching and even bone is deformed here from the pincer damage. So in skiffy, in CAM, it's articular cartilage that does the damage. In skiffy, it's a metaphyseal bone that causes the damage. In CAM, the articular cartilage is softer. In skiffy, it's abraded, and the labrum is crushed, so they're not the same. So FAI, the symptoms are somewhat vague. You have hip pain, thigh pain, or knee pain. A pain with flexion activity is the most common, but you can also have pain only with running activities and not with flexion from anterior FAI. And it's not uncommon to have associated problems like avulsion fractures are more common with hip stiffness. Pubalgia, SI joint strain can also be secondary to FAI. And people may occasionally complain of clicking, locking, and giving away sensation in the hip. The most sensitive exam is your impingement sign, the flexion, adduction, internal rotation, the Fodder sign. Faber is more for lateral, anterolateral impingement, and you can have a posterior impingement sign exam with the extension external rotation. The most important thing for me is when I flex up to 90 degrees, I measure how much internal rotation they have, and that's what tells me what type of FAI they have.